Hello, my name is Mark MacBayne. I'm the practice administrator for hematology oncology and adult bone marrow transplant at UCSF Medical Center. I'm here today to talk about how to become a psychiatrist. A psychiatrist is an MD who specializes in the treatment of mental disorders. The first step in becoming a psychiatrist is to go to college. You must complete a 4-year course of study at a college or university. Typically, if one is interested in a career in medicine, you will major in a science such as biology or chemistry. However, this is not required. If you choose to major in something other than a science discipline, however, you will need to make sure you take all of the science prerequisites, which includes 2 years of chemistry, 2 years of biology, a year of physics, and a year of calculus. Medical school is extremely competitive, and in order to be a strong candidate for medical school, you will want to keep your undergraduate GPA at 3.7 or above. As you near the end of your undergraduate career, you will need to take what's known as the MCAT. That's the Medical College Admissions Test. All students who are applying to medical school must take the MCAT, as it is the standardized entrance exam for medical school. Medical schools use your MCAT scores along with your undergraduate GPA in considering your strengths and viability as a candidate for their school. Once accepted to medical school, you've committed to an additional 4-year course of study. The first 2 years are typically devoted to didactic instruction in the health sciences. The second 2 years are typically reserved for training in clinical skills. Upon completion of your 4 years of medical school, the degree of medical doctor is conferred. However, you're not quite ready to practice as a physician. Upon graduation, you need to complete what's known as a residency. This is formal postgraduate training, and this is where the time at which a physician will specialize in a given area of practice. In this case, we're talking about psychiatry. A psychiatric residency will be a minimum of 4 years, and this is time engaged in clinical interaction with patients under the supervision of a psychiatrist. Upon completion of your residency, many will go on to complete a fellowship, which is an additional 1 to 2 years of formal training. After you have completed all of your postgraduate education, you're ready to sit for your board exam as a psychiatrist, and upon being boarded, are ready to practice as a psychiatrist in the community. This is Mark MacBayne, Practice Administrator for Hematology Oncology at UCSF Medical Center.